OCD, or obsessive compulsive disorder, is a disorder that's characterized by unwanted, intrusive thoughts, images, or urges that the person experiencing them finds very disturbing and unsettling. Maybe it causes them anxiety or disgust or some other kind of distress. And in response to that, they engage in these behaviors called compulsions, which would be mental or physical acts that they use to try to get certainty that these thoughts or feelings aren't going to cause anybody harm or cause them harm. And the problem is that it becomes a disorder when people get stuck in this loop of dealing with their unwanted thoughts, trying to get them to go away, and then finding that they have to do more and more and more to feel certain and to feel safe. And then over time, this begins to impair their functioning. They're spending more and more time throughout the day. So OCD is a biopsychosocial mental health condition. And what that means is there's a sort of a genetic or family underlying component or predisposition. And when that manifests, that's when people start to engage in these compulsive behaviors. And then they start to learn from those behaviors that they have to do them. And so as that worsens, they get more and more stuck and it becomes more and more of a disorder. We want to make sure that every person who's here primarily for OCD is getting at least 3 hours of dedicated exposure and response prevention time. And they're also getting enough time with their attending psychiatrist and with their dedicated OCD specialist. So during the weekday, you're going to get 4 days a week, 1 hour each day with your OCD specialist provider. And then 5 days a week, you're going to also get an hour of guided exposure and response prevention, which is also one-on-one treatment, but it's more focused on just doing the work and less focused on the psychoeducational components you might get in your regular treatment. You'll also get an hour every day of staff-assisted independent exposure and response prevention. So what that means is you're using the tools that you've learned in your treatment, but you're also getting the support of the retreat staff, the nursing staff that's around you. In addition to the individual one-on-one OCD treatment you get with an OCD specialist, we're also providing weekly CBT group therapy, so you can integrate the tools in that fashion, and also weekly OCD support group. A lot of what I see happening here at the retreat, and what's great about how well integrated it is with the OCD services, is they have art therapy, they have recreational therapy, they have yoga and DBT, emotion regulation skills, all the things that you need not just to resist your compulsions and to tolerate uncomfortable feelings, but to take these concepts and really integrate them back into your life so you can learn to live joyfully again. I think what's really important to know about the OCD program at the retreat is though we're using evidence-based treatments, we're using CBT, we're using ERP, we're also thinking about the individual. We're not using a manualized cookie-cutter approach, and individuals come in with a variety of different needs, complex cases, but even those cases that aren't so complex, people are complex. What we want to do here is take evidence-based treatment for OCD that we know works and want to apply it to the individual.